Professor, Physician, Epidemiologist. I am Dr. Sri Banerjee. Hello, I'm Dr. Sri Banerjee, epidemiologist, biostatistician, geospatial expert. In this video, I will be going over a little bit about the National Health and Nutrition Examination Survey. So for starters, what is this survey and why is it so important to find out more about? Well, what it does, in a nutshell, what it does is it assesses the nutritional and health status of adults and children in the United States. So that is basically what it does, but it actually does a lot more. So let's see a little bit more. So it comprises of not only a home interview, but it also entails an actual examination. So medical practitioners actually do a thorough physical exam and actually run other diagnostic tests as well, which I will be going over shortly. And then as well, you have a very large number of lab studies that are ascertained for this sort of measurement. So in terms of, for instance, one example that I use is C-reactive protein. This is a nephelometry sort of specialized technique, and there is data for the general population for now decades. So this is a very wonderful strength of this data set. And then post-exam content, of course, you have a dietary recall interview and also physical activity monitoring. So if you look on the actual website, if you were to explore one of the variables, one that I use a lot in many of my studies, and actually come to think about it, in the last 6 months, I believe I've had at least 10 original conceptualized studies, which I have collaborated with others and published at various conferences, but not only that, also presented and also published in peer-reviewed journals. So I'm drawing from a lot of this expertise to provide you with the contents of this lecture that I'm providing for you. So the examinations in the mobile exam unit, MEC. Now you'll see this actually within the content of some of the variables, and you might not understand what that means, but each of these acronyms have a lot of meaning, and they provide more context as to how the original study was conducted. So the whole idea is that this original study and this original data collection, this original surveillance has been conducted for you so that you can propose original studies from the methodologies that have been done for you. So the idea is that the government has spent millions of dollars to compile all of this data within a centralized location for your convenience, so that you can actually run very unique and original analyses and propose original studies. And as I'm going through this, please think about various types of research questions that you could be creating. For instance, with the diabetes, take a moment to pause there, pause your video over there, and try to be thinking about what are some of the research questions that you could be creating as it pertains to diabetes. So in the mobile exam center, you have examinations which provide unique content and operational challenges, of course, because whenever you're doing a physical exam, it not only requires the physician and the patient to be in the same place, but also the equipment to be working properly, if there's x-ray machines or any other sort of equipment. So there's 15 sites per year, all across the United States, and they're not usually the same 15 sites. There's different ones selected each year. and every 2 years. And so the mobile laboratory is comprised of not only thinking about specimen processing and storage, so the right temperatures, thinking about when we were talking about the COVID pandemic, there's a lot of talk about storing vaccinations at the right temperature. And so this is a very important consideration. And of course, then you have the equipment that you have in the mobile examination units. And so you can see these mobile units actually traveling across the country. And if you're lucky, you might actually see one of these while you're driving on the highway. But these are how they look, and a lot of them are parked within the parking lots various centers, so that it's made convenient for people from various communities to access, and so that there's more of a representation of the sample that is being collected. So what are some of the MEC activities? So the mobile exam centers, what were some of the things that were being collected? And the reason I say pre-pandemic, because shortly I'll show you how the pandemic actually affected data collection. The reason I included this within this talk is because I think it's really not only key to understand the way that data is collected, but also when there are unexpected interruptions that take place within the population level, how that interrupts sampling, and how data scientists can create techniques to recover from some of these unintended emergencies. So just looking more into the MEC activities, body measures are always important. This is something that, of course, I did a lot of when I was seeing patients and taking measurements. Head circumference was an important measure, of course, but not only that, blood pressure. I've taken many blood pressure readings at the beginning of a physical exam, and also DEXA scans. And so these are more of bone density, so looking for osteoporosis, oral health exam, phlebotomy, urine collection, interviews, and importantly, and the reason I highlighted this is because standardized protocols are really important. So if you have the standardized protocol equipment in an exam, it's really then you can ensure that the data collection was in fact standardized between various sites. But without this, there's no way to really ensure this. So looking further and looking at some of the examples over there on the left, of course, there is a measurement being done for the height of a child, and then to the right there's actually a x-ray machine, and then the dentist on the bottom is conducting an oral exam. And so these are all data points that are entered into the NHANES dataset. So I hope this is giving you some context into when you open up your next dataset and you see a list of variables and you see a list of numbers. It's not just numbers. I'm hoping you're seeing some visuals and understanding of how some of this data collection takes place behind the scenes before these numbers are created. Okay, so what is the data collection frequency? Well, there's a continuous field operations that began in 1999. So any sort of NHANES collection data set is referred to as continuous NHANES starting 1999. So data released in 2-year cycles, and so typically you're conducting a lot of cross-sectional studies, but there is actually provision for conducting longitudinal studies in rare instances, but only if you're linking up other data sets. So strictly speaking, when you're conducting and proposing an original study from the National Health and Nutrition Examination Survey, you will be proposing a cross-sectional study. And now there are ways that you could do some matching between subjects, and sometimes then that leaves provision for other types of potential nested sorts of potential case control studies from cross-sectional. But this is in a nesting sort of way. You can look into some of these terminology in Google, and see if you can find more information of these variations of study designs. But that's beyond the scope of this talk, but here I can show you that it's really advisable to be combining cycles when you're talking about rare diseases or subgroups that may not have as much of a sample size as the larger group or the larger category. So here's an example of how 2-year cycles, multiple 2-year cycles are combined. And so you can see at the top first, you have the 2015-2016 cycle in 30 locations. And then if you look in 2017 and 2018, you have 30 locations. So 2015 to 2018, if you were to combine all of the data sets, then you would have 60 locations, data set for 60 locations, and that would yield a more complete picture of what you are trying to study than if you were to only use 30 locations. So this is how it would look on the right on the actual website, and this is the 2017-2018 NHANES dataset. So these are the categories, various categories that you can be finding. Demographics is a very important category, of course, that involves a lot of and includes a lot of information about survey design, and then information about the sample weighting that you may need to include if you are to conduct a complex samples regression analysis. And the other types of important and interesting types of categories is the examination. So not only audiometry, measuring hearing, but also some of the basic measures that we went over, including blood pressure, body measures, muscular strength, oral health, and vision exam. So this is an example of how the daily number of COVID cases was rising in March of 2020. So just to back up here a little bit, this slide now is going into showing how when the pandemic hit, we were actually in the process of collecting the continuous 2019 to 2020 NHANES dataset. So all of 2019 had been completed, and so we had gotten into March of 2020 when there was an increase, and so the mobility all of a sudden mobility halted, and so if you look now, transit stations stopped working, workplaces shut down, and so a lot of these planned visits actually had to be halted. So there was a big moment of panic to try to figure out what to do because of the interruption. So here was, as I told you already, 30 planned locations that were planned, but then only 18 got actually completed. So there was no feasible way to resume all of this data collection in 2020, as you know. And so all the way from 2019 to March 2020, the sample was not nationally representative. There was no method to create sample weights, and so the data release could increase disclosure risk. And so if there was less subjects within a category, then this would result in a faulty sort of result. So a solution, what was the solution? Well, the statisticians then got together and decided that the 2017-2018, there was actually a complete file there. So completing a combined sort of methodology with 2017-2018, along with the partial probability sample that was yielded from 2019 to 2020. This was the way to circumvent this problem, this unintended, unforeseeable problem. And so, of course, there was a data cycle combination approach that was used. So 30 of 30 locations were visited in 2017 to 2018, only 18 out of 30 in 2019 to 2020. So the sample designs ended up being different. So what ended up happening is the design for 2015 to 2018, that design then was used to apply to 2019 to March 2020. And so there was a creative solution that was used um, from a pattern from the past. And so they didn't really exactly line up. The sample design in some portions were underrepresented, so there actually needed to be an additional adjustment factor. So there were weights in interview and examination. And then, of course, the assessments were confirmed in comparison to the American Community Survey. And I talk about the American Community Survey in great detail as it pertains to geospatial research. So this is an example of the NHANES website, and the data documentation code books are all available in one place. And this is not just for the 2017-2020. This is for other years as well. So if you would like to use the pre-pandemic years, those are available as well. So here is an example of some of the variable names that you might see. This might look familiar. BPQ means blood pressure and cholesterol, diabetes, DIQ, etc., etc. So this is an example of how to use the data. All of the details of survey methodology, response rates, everything is available. And then you have a guidance on how to prepare the files in this website. So in summary, NHANES during the pre-pandemic time had some interruptions, and there were solutions that needed to be sought, and these are the solutions that were created, and all of the files along with the weights can be found in the following websites that have been provided. So if you are looking for the 2017 to March 2020 file combining all of the data, then you can find it on that website on the top, and then in the middle, if you want to access the confidential combined 2017 to March 2020 pre-pandemic data, then you can visit the Research Data Center. I have talked with individuals within the Research Data Center and have contacted other universities that have been affiliated. And so there is a cost that is connected to using data, and also some sorts of regulations, and so it's important to keep these in mind before accessing data set from here. And then also you can have data collected only during 2019 to March 2020, but there's no weights for this, so some of the estimates, many of the estimates may not be accurate. Thank you for listening.